Yeah, you guys know that in gastrointestinal tract physiology, we have to do a little bit of anatomy of the components of the gastrointestinal tract. Okay, so today we'll be doing anatomy of the anal canal, and the anal canal is the last portion of the gastrointestinal tract. Okay, so guys, on our screen is a good example of the anal canal. Okay, but I think this is um a segmented one. Okay, let me see if I have okay, this is a better examples. Okay, so these are the buttocks and the anal canal here. All right, so let's talk about the anatomy of the anal canal. I would say that it is the last part of the gastrointestinal tract. Okay, it is about 3 to 4 centimeters long. Okay, so it lies what extra peritoneally. It begins at the anorectal junction, distal from the perineal flexure, and ends at the anus. Okay, so the anus is different, and the anal canal is like the space there. Okay, the anus is like the outer covering, outer view. Okay, and the anal canal is like the space there. Okay, so this anal canal is divided in three anatomical zones. Okay, it's divided into the columnar, the intermediate, and the cutaneous. Okay, columnar, intermediate, and the cutaneous. Right here, you can see the columnar side, um, columns. Okay, and the cutaneous is like the outermost part. Okay, that is near to the skin, because anything near to the skin is actually cutaneous. Okay, so the intermediate should be in between the columnar and the cutaneous layers. Okay, so the dentate or the pectinate line divides the anal canal into the upper 2/3 and the lower 1/3. Right, let's see this. Okay, so this is the dentate, and cutting the line here, which is the dentate or pectinate line, you can see that the upper is actually larger than the lower. Okay, so upper is called what 2/3, while the lower is called what 1/3. Okay, so each one being supplied completely by different neurovascular structures. So the function of the anal canal include what maintenance of fecal continence and defecation. Fecal continence is like, okay, you holding back feces when you don't want to defecate. Okay, so that's fecal continence. Then when you want to defecate, you release the anal sphincter and everything is out. So this is achieved with the help of what anal sphincters, like I just said, and the neighboring what puborectalis muscle. So guys, this is the anal canal, and you could see this is the anal canal, and the outer is actually what is called what anus. Okay, you can see the anal sinuses, you can see the anal columns. Okay, you can see the external anal sphincter, you see the internal anal sphincter, you can see the hemorrhoidal veins. Okay, you can see the levator ani. Okay, so just like a flashback on what we said. We said that the anal canal is about 3 to 4 centimeters total length. Okay, I don't think it's good to be specific and say it is 3 centimeters. All right, it's always good to give it a range. Okay, so you could say that it is 3 to 4 centimeters long. Anal columns are longitudinal ridges separated by mucus. Okay, and they secrete what anal sinuses. Okay, so hemorrhoids are permanently distended veins. Okay, these are the veins. Anything you see in blue here is the hemorrhoidal veins. Okay, so here we see that they are permanently distended veins. Okay, so let's move. Now let's talk about the blood supply. I will say that the blood is supplied by what superior rectal artery, which is a branch of the inferior mesenteric artery. Okay, and the venous blood flow through the internal hemorrhoidal plexus that we just saw here. These are the hemorrhoidal veins. Okay, blood is drained through them. Okay, and it drains from this hemorrhoidal plexus or hemorrhoidal veins into the superior rectal vein. Okay, all right, back to the hepatic portal system. Now, the lymph drain into the lumbar. That we're talking about the lymphatic drainage. Okay, the lymph here will drain into the lumbar or the para-aortic lymph nodes. Okay, and the sympathetic innervation is carried out by what inferior mesenteric plexus, while the parasympathetic innervation is carried out by what? Pelvic splanchnic nerves, and the inferior hypogastric was plexus. Okay. Let me go over the nervous supply again. The sympathetic innervation is carried out by what? Inferior mesenteric plexus, while the parasympathetic innervation is carried out by what? Pelvic splanchnic nerves, okay, and the inferior hypogastric was plexus. Okay, I don't think we have the labeling of the nervous supply here, okay, but you could appreciate the hemorrhoidal plexus. You can see that we have the external hemorrhoidal plexus and we have the internal hemorrhoidal plexus. Okay, you could appreciate the external anal sphincter, okay, which will dilate when you want to defecate and will constrict when you want to hold back, okay, feces. You could also appreciate the anal columns and the sinuses, okay. And on the left side, we're just talking about the histology. We see that there's a stratified squamous epithelium, okay, and you can see the stratified squamous epithelium too, which is low keratinized. Okay, so basically this is it, guys, and this is about the anatomy of the anal canal. Okay, anatomy of the anal canal. Okay, and best you should know that it is into 3 zones: the columnar zone, the intermediate zone, and the cutaneous zone. Okay, so see you guys in the next tutorial, and bye for now.